Hello, my name is Maya Alexis. I'm a third-year medical student at the University of Pennsylvania. One of my research interests within functional neurosurgery relates to targeting and deep brain stimulation, and I wanted to take an opportunity to very quickly talk about deep brain stimulation for obsessive compulsive disorder and a role for connectomics as it relates to DBS for obsessive compulsive disorder. Here are some terms that will be relevant. DBS, or deep brain stimulation, refers to a surgically implanted device that delivers electrical pulses to targeted parts of the brain for therapeutic modulation of brain circuits. Research studies and trials are underway for the use of DBS to treat many disorders, including movement disorders, pain, and psychiatric conditions, but several clinical indications already hold FDA approval under the Humanitarian Device Exemption Program for the use of DBS today. Obsessive compulsive disorder, or OCD, is a disorder characterized by uncontrollable, intrusive, repetitive thoughts or obsessions, and ritualized, repetitive, neutralizing behaviors or compulsions. Severity and subtype of the disease can be assessed with the Yale-Brown Obsessive Compulsive Scale, or YBOX. For the past 20 years, DBS has been studied as a therapeutic option for patients with treatment-refractory OCD. In fact, it currently holds FDA approval under the Humanitarian Device Exemption Program for treatment of severe refractory OCD that has been resistant to 3 or more selective serotonin reuptake inhibitors, or SSRIs. Many studies and meta-analyses have been conducted to assess its efficacy. One meta-analysis specifically found a pooled average YBOX reduction or symptom reduction of about 40% 1 year after DBS treatment. Another meta-analysis found that 66% of patients were full responders at their last follow-up after DBS surgery, with full response being characterized as more than a 35% reduction in YBOX. Several targets for OCD DBS have been trialed, including the ventral capsule ventral striatum, or VCVS, the anterior limb of the internal capsule, or ALIC, the nucleus accumbens, the bed nucleus of the stria terminalis, or the subthalamic nucleus, or STN. While these targets are often referred to distinctly in the literature, it is important to note that there is a lot of overlap. For example, ventral capsule in VCVS really refers to the anterior limb of the internal capsule, and ventral striatum encompasses the nucleus accumbens. In the figure on the right, we can see just how anatomically close these 3 reportedly distinct targets are and how there might be a lot of overlap when we target them independently. I wanted to highlight here a study published by Dr. Casey Halpern's lab in 2019. This study was done on an awake patient during a DBS surgery for OCD, and microelectrode recordings were taken from the ventral striatum as a patient's contamination obsession was directly provoked by asking him to hold a dirty toothbrush to his face and imagine brushing his teeth with it. During this direct provocation, there was modulation of both the neuronal firing rate and oscillation amplitude within the ventral striatum, as demonstrated in figures C and D on this slide, respectively. I wanted to share the intraoperative video from the study. Here we see a visual representation of the firing rate that was being recorded from the ventral striatum, first during a baseline period, and now during direct provocation of the patient's obsession as he's asked to hold a dirty toothbrush to his face and imagine brushing his teeth with it. And we can appreciate a marked increase in the firing rate during this task. To control for the motor movement of moving the hand to the face, he is asked to make the same motion without the toothbrush with no valence associated, and we do not see the same marked increase in firing rate from this area. I wanted to highlight this is one of the first studies to show an electrophysiologic signature underlying obsessive thoughts in a patient with OCD within the ventral striatum, which is an important consideration when we think about the applicability or targeting of DBS for this pathology. Connectomics is an emerging field that could play a role in informing DBS research, including DBS for OCD. There are many trial targets for OCD DBS, as we spoke about in the previous slide, and it is fair to hypothesize that they may all be acting on a unified circuit. This is what the study here aimed to address. This slide is in reference to a paper from Lee et al. Published in Nature Communications in 2020. The authors separated a cohort of patients who underwent OCD DBS targeted at either the ALIC, the anterior limb of the internal capsule, or the STM. They looked at a set of fiber tracks or normative connectome derived from diffusion MRI data of 1,000 healthy subjects, where a connectome is defined as a comprehensive map of neural connections within the brain. They then looked at the electrical field created from the patient's DBS electrodes as defined by the electrode location within the brain and the stimulation settings. They refer to the tissue affected by the electrical field as the volume of tissue activation, or VTA. They then compared the VTAs as they overlapped with different fiber tracts from the normative connectome between good and poor clinical DBS responders. What they discovered was a commonly affected pathway in patients with either electrode location, either targeted at the ALIC or the STN. This pathway was within the medial prefrontal cortex and connected the dorsal anterior cingulate cortex to the STN. Not only was this pathway common between both groups, but its activation was correlative to good clinical response post-DBS. It is important to define that when we talk about pathway or tracks, when we talk about connectomics derived from diffusion MRI data, we're not necessarily referring to delineated anatomical tracks, but rather streamlines that represent continuous trajectories as defined by the diffusion MRI. This figure illustrates this proposed track or streamline between the dorsal anterior cingulate cortex and the STN, and shows how many of the proposed DBS targets cluster around it. For example, the VCVS, the BNST, the nucleus accumbens, the ALIC, the STM. Previously, we spoke about the amount of overlap that exists between these targets and the nomenclature of these targets. And what this suggests is that it may not be targeting one of these specific regions that is key, but rather targeting a location within these regions that has the most connectivity to certain circuits that have the best therapeutic response, such as this potential circuit. This study demonstrated that connectomics may be key in finding a unifying DBS target that can optimally modulate circuits that play the biggest role in pathology or yield the largest response rate. Future directions cited by the authors include preoperative phenotyping that could use symptom and connectomic network profiling to plan exact DBS targets that may be most beneficial for that patient. These are the references that I used in this talk. Thank you so much.